Hi, my name's Kelsey. I'm your nurse practitioner today.
I'm Kendra.
Nice to meet you. What brings you in today?
My yearly checkup.
Great. What's your date of birth?
June 2nd of 2005.
Okay. What grade are you in? Or what grade are you going into for school?
I'll be a senior.
Oh, great. Nice. Do you have any past medical history?
No.
Past surgical history?
No.
Any allergies?
No.
Do you take any medications?
I take a vitamin every day.
Okay. Do you have any family history?
My dad has high blood pressure.
Okay. I'm gonna ask you a few questions. You can say yes or no.
Okay.
Have you had any headaches?
No.
Any change of vision?
No.
Vision loss, blurry vision?
No.
Hearing loss?
No.
Ringing of the ears?
No.
Any nasal congestion?
No.
Any mouth problems? Any chest pain, chest tightness, palpitations?
No.
Any trouble breathing?
No.
Have you had any coughing or wheezing?
No.
Okay. Have you had any abdominal pain, nausea, vomiting, diarrhea, or constipation?
Only after I eat like dairy or really rich foods.
What happens after you eat dairy?
I get like really bad stomach pains if I eat too much of it. Sometimes it's just like a little discomfort, but if I eat too much, I get really bad stomach pains.
Do you take anything for the pain?
I take Lactaid, and that helps.
Before you eat the dairy?
Yeah.
And that works for you?
Yeah, unless it's like really rich foods, which also gives me a stomach ache, but like the Lactaid doesn't fix that.
Okay. So besides the dairy and the rich foods, does like anything else cause the stomach pain?
No.
Okay, good. Have you had any problems urinating?
No.
Pain or burning on urination?
No.
Urinary frequency or hesitancy?
No.
Any vaginal discharge?
No.
Any neck pain, back pain?
No.
Any pain with your knees or ankles?
No.
Any swelling in your legs?
No.
When was your last menstrual period?
Like 3 days ago.
Okay. And they're usually regular, like every 4 weeks?
Yeah, like every 4 weeks.
Okay. And when you're in a car, do you always wear seatbelts?
Yes.
Good. Okay. Do you smoke, drink, or do drugs?
No.
Good. Okay. Okay. So now I'm gonna do your physical assessment. I'm gonna start with your head and then work our way down. All right. So first, I'm going to assess your eyes. Let me.
I need to take off my glasses.
Yes, please take off your glasses. Okay. So I'm gonna have you follow my finger with your eyes. Good. Okay. Look straight ahead for me. Good. Okay. Okay. And you can still look straight ahead. All right. Good. Okay. So the red reflex is present. Patient was able to follow my finger with both eyes symmetrically. Her pupils constricted and dilated appropriately. All right, so I'm gonna have you raise your eyebrows and then smile, frown, about your cheeks. Good, okay. Now I'm going to assess your ears. Okay. The tympanic membrane is pearly gray and translucent. I'm going to have you look up for me. Good. Okay. And then open your mouth. Say ah. Good. And then palpate your sinuses. Any pain? Palpate your lymph nodes. Any pain? No. Patient's nasal turbinates were pink. No erythema was noted in the nasal canal. the mucosa was moist, no lesions noted in her mouth. Her tonsils were not enlarged, and no lymph nodes were noted to be enlarged or painful. So I'm going to have you swallow for me. All right, no thyroidmegaly noted. And then, okay, I'm gonna have you raise your eyebrows, smile, frown, puff out your cheeks. Good. Okay. And then, so cranial nerves 2 through 12 are grossly intact. Now I'm going to move on and listen to your heart and lungs. Okay. You can just relax, okay? Okay. Take a deep breath for me. You can look that way for me. Thank you. And then turn towards me. Okay, so S1 and S2 heart sounds were noted on auscultation. No murmurs, rubs, or gallops. Her anterior lung sounds were clear, with no wheezing, crackles, or rails noted, and no carotid breweries noted. All right, take a deep breath for me. Posterior breath sounds were clear in auscultation. No wheezing, rails, or rhonchi were noted. I'm going to just palpate your back. No tactile fremitus was noted. Turn towards that way just a little bit. Thank you. All right, take a deep breath in and out. Symmetrical chest excursion was noted. And then percuss. Resonant lung sounds were noted on percussion. You can turn back towards me. And then I'm going to have you lie down, and you can put your legs up here. Okay. So now I'm going to listen to your abdomen. I'm going to palpate it after. Okay. Sorry. Positive bowel sounds were noted in all 4 quadrants. I'm just going to palpate. Sorry. Any pain when I press down? No? Okay. No pain noted on palpation. No organomegaly noted. Sorry. Just put underneath the pants. So percussion sounds were normal. And then I'm going to just check your legs for swelling. No leg swelling noted. +2 pedal pulses noted on palpation. Her lower extremities, No lesions noted, no redness, good blood flow, her legs are nice and warm. Her capillary refill on her toes is less than 2. I'm going to just raise your knee for you, okay? You can bend it, good, and go out, good, bend it towards your, good, and out. And then put your leg all the way out, all the way back in, good. Same thing with this leg, bend your knee, out, bend, out, leg out, and then go up and down, good. Full range of motion of her hips and her knees without pain. And then you can just rotate your ankles for me. Any pain? And you can point your toes down, point them up. Okay. So full range of motion of her ankles. I'm gonna have you go up against my hand. Right, press your legs up. All right, and down. Good. Full muscle strength, 5 out of 5 on her lower extremities. You can sit up now. Okay. Okay, so turn towards me a little bit. I'm gonna have you put your arms out, up, rotate your shoulders the other way, and then bend your arms like this and out. Move your wrists around. Open your fingers up, go in. Any pain when you're, no? So full range of motion of her shoulders, her elbows, and her wrist. Let me see. Just checking your pulses. +2 radial pulses noted. Okay, I'm gonna have you stand up for me. I'm gonna have you come around over here. Okay, so I'm gonna have you turn around and you're gonna walk heel toe, heel toe. Good. And then you can come back towards me. Good. And then put your arms out straight. Close your eyes. Good. Okay. Patient's gait and coordination and balance are intact and appropriate for her age. All right. Turn with your back towards me. Touch and bend down and touch your toes. All right. Normal spine curvature noted. Then you can turn back around. Good. So just relax your legs. Good. +2 reflexes noted. And then, good. Good. Okay. +2 reflexes noted. This is a 17-year-old female who presents to the office for an annual well visit. Her physical exam findings were normal. During the review of systems, she mentioned that eating dairy products or products that contain lactose caused her to have abdominal pain, nausea, or diarrhea. For this patient's lactose intolerance, I would recommend that she continue to take Lactaid prior to consumption of dairy products. I would also recommend that she takes a daily calcium and vitamin D supplement, as patients who have lactose intolerance tend to have inadequate supplies of calcium and vitamin D in their daily diet. If the patient's symptoms worsen despite taking Lactaid, I would recommend that she follows up with a GI specialist for further evaluation. I would educate the patient on safety tips, which include always wearing a seatbelt while in a car, never texting while driving, avoiding alcohol, nicotine, and drugs, and practicing safe sex. The patient is currently up to date on all her vaccines, but I would recommend that she gets a flu vaccine during the flu season. I would have the patient follow up in 1 year for another annual well visit.